Joining us once again, managing partner, PCS Advisors, Paul Seegert. Paul, what do you have on your radar for us?
Well, we have as many as 14 million people that could lose their health coverage that is currently provided through Medicaid because of the CARES Act or some of the rescue legislation, basically with COVID. States have not been recertifying people's eligibility so long as there's a public health emergency in place as part of the rules associated with that. And many of those folks won't qualify. They've either had an increase in income or have coverage now available through their new employment and that kind of thing. So as many as 14 million could lose that coverage as we head into an election cycle.
No doubt there'll be attention paid to this. You bring up some instructive points, though, and it's kind of I think important as well that we kind of take stock of where we are and what's happened. Of course, a prominent reason why we are facing 41-year high inflation is because we ended up inventing a bunch of money out thin air and handing it out to people as though it was candy and expecting there not to be consequences. Obviously, there have been. Now, as part of that candy, the expansion of Medicaid came into play here. So as we were paying people not to go back to work, we were taking those people that were not working, that we were paying not to work, and we were putting them on state Medicaid programs. Now, like when President Biden spoke earlier this week and said, hey, the deficit's coming down. The truth of the matter is not because of, intentional spending, but to your point, Paul, sunset measures, pieces of programs put in place during the so-called, American Rescue Plan or Act, and that are just phasing out. And one of those will be this Medicaid piece. So, Paul, I guess the question is, and I don't know if there's a good handle on this yet, especially given that, we're taking out an economy that might be in real time starting to go the other way. Is this something that makes sense? In other words, I certainly do not believe that people that are perfectly capable of working should be, supported by all their fellow taxpayers for medical coverage, no cost to them. So is this a real need, or is this a situation where, it's going to be a lot of political posturing and a lot of political talking points?
Yeah, I think it's the second, and you bring up a really good point. When I go through, it's easy to pull out one number and create some real fear around it or some big headlines, but the reality is we only decreased the uninsured numbers in this country by less than 2% during this whole period of time. So we moved a lot of people from other coverage to government-provided coverage or government-subsidized coverage. Another way we did that was to remove some of the subsidy requirements for the exchange plans. So not only did we expand Medicaid, but we said, hey, if you go to the exchange, no matter what your income, you're not going to pay more than 8.5%. Well, that meant a 60-year-old couple making north of $200,000 could get some subsidy if they went to the exchange. So we created this moral hazard where we drew people onto either government coverage entirely with Medicaid or a government-subsidized plan. And in that whole process of doing both of those things, we moved the needle less than 5 million Americans in terms of reducing the uninsured number. But we added, 14.4 could lose coverage in Medicaid, not to mention all the folks that moved on to exchange plans with subsidies that left other coverage from their employer or other individual plans.
Paul, no doubt some people are going to hear this and might have had a legitimate hardship, might be in the mix here. Is it safe to say that if one was extended Medicaid coverage during the window of time we're talking about here, that perhaps that's the person that's going to be caught in the timeline you're talking about here?
Yeah, if they are removed, if they recertify and they're removed from Medicaid, very likely then they end up going to the exchange and also getting a subsidy there. So they're not going to be left out in the cold entirely. They'll still, whatever they qualify for, they'll still be able to access. And that'll be a qualifying event for them to seek that other coverage. And I think many of those, we're just going to see a shift from Medicaid to the exchange plans where they may have a partial subsidy instead of a total subsidy.
Great update. Appreciate it, Paul. Thank you very much.
Have a great day.
Yeah, it's Paul Seegert, managing partner, PCS Advisors.